MRI shows a delaminated rotator cuff tear, with a few bursal fibers intact, and some biceps inflammation and tearing. Position her in the lateral decubitus position. Her right arm was placed in balance suspension. Tear is marked with 2 spinal needles. Clean off the tuberosity, and made sure to have good surface for healing and also for placing anchors. One triple-loaded anchor was placed posteriorly, and 2 sutures from the anchor were passed through the posterior aspect of the cuff. Release the biceps from the labrum without issue. Patient's portal sites were closed with 3/0 nylon.